Do you consume enough vitamin B12? In order to stay healthy, you'll want to make sure you do. Vitamin B12 has numerous health benefits. It aids in the formation of DNA and red blood cells. Because your body does not produce vitamin B12, you must obtain it from animal-based foods or supplements, and it's something you should do on a regular basis. While B12 can be stored in the liver for up to 5 years, if your diet does not help maintain levels, you may become deficient. In this video, we're going to describe 8 B12 deficiency symptoms and how to diagnose and treat them. Just a friendly reminder that this video is only meant to teach. So if you have any health concerns, please talk to your doctor. Here are the 8 signs and symptoms of vitamin B12 deficiency. 1. Fatigue. B12 deficiency causes fatigue. B12 helps your cells function. Insufficient B12 can reduce red blood cell production, reducing oxygen delivery. Megaloblastic anemia is caused by B12 and folate deficiencies. Large, abnormal, immature red blood cells and impaired DNA synthesis result from this condition. When your body lacks healthy red blood cells, you may feel weak and tired. Even if your B12 levels are within range or borderline low, you can develop fatigue and other symptoms. 2. Skin that is pale or yellow. Pale or yellow skin is another indicator of B12 deficiency. Anemia caused by B12 deficiency, like iron deficiency anemia, may cause your skin to appear pale due to a lack of fully matured, healthy red blood cells in the body. B12 deficiency can also result in jaundice, which causes your skin and the whites of your eyes to turn yellow. The color is caused by high levels of bilirubin, a waste product produced by your body when red blood cells are broken down. 3. Headaches. B12 deficiency can cause headaches. Headaches are a common symptom of B12 deficiency in adults and children. Some studies show that people with frequent headaches have low B12 levels. A 2019 study of 140 people, half of whom had migraines, found that migraine sufferers had lower B12 levels than non-migraine sufferers. Those with the highest B12 levels were 80% less likely to have migraines. 4. Depressive symptoms. B12 helps your central nervous system function properly, and a deficiency can affect your mental health. B12 deficiency increases depression risk. Low B12 levels can raise homocysteine levels. Increasing oxidative stress, DNA damage, and cell death may contribute to depression. A 2020 study of 132 children and teens found that those with depression had lower B12 and higher homocysteine levels. Low B12 levels can cause psychosis and mood disorders, in addition to depression. 5. Gastrointestinal problems. Diarrhea, nausea, constipation, bloating, gas, and other gastrointestinal symptoms can all be caused by a B12 deficiency. Both adults and children can be affected by these issues. However, keep in mind that many of these symptoms are general and could be caused by other factors. Food intolerances, medications, and infections, for example, can all cause diarrhea. 6. Concentration problems and mental impairment. People with low or deficient B12 levels may feel foggy-headed and have trouble concentrating and completing tasks. B12 deficiency increases with age, so older adults are especially at risk. Low B12 levels have been linked to poor mental function in older adults. Studies show that low B12 can improve mental impairment. A 2020 study gave 202 people with mild mental impairment, low or low normal B12, and high homocysteine B12 replacement therapy for 3 months. 84% of participants reported improvements in symptoms like poor focus, memory decline, and forgetfulness. 7. Pain and inflammation of the mouth and tongue. Glossitis is an inflamed, painful tongue. B12 deficiency causes it. Glossitis and stomatitis can occur in people with this deficiency. Glossitis and stomatitis are common in B12 deficiency-related anemia, but they can also occur without anemia and signal an early B12 deficiency. Deficits in folate, riboflavin B2, and niacin can also cause glossitis. B3. 8. Hand-foot paresthesia. Paresthesia is a burning or prickling sensation in the hands and feet. B12 deficient adults and kids report paresthesia. This B12 deficiency symptom overlaps with diabetic neuropathy symptoms, which cause pain and numbness in the extremities. Metformin can reduce vitamin B12 absorption, putting diabetics at risk for B12 deficiency. So, diabetics with a B12 deficiency may have peripheral neuropathy. Experts recommend screening metformin users for vitamin B12 deficiency. What causes and treats B12 deficiency? Because vitamin B12 deficiency symptoms aren't specific, it may go undiagnosed. If you have any of the above symptoms, see a doctor. This is especially relevant if you follow a restrictive diet, like a vegan diet, are over the age of 60, are pregnant or breastfeeding, have a medical condition that can deplete B12 levels, take a B12 depleting medication, like metformin or proton pump inhibitors. A doctor can rule out a B12 deficiency by ordering blood tests and learning about your symptoms. This includes B12 levels, folate levels, a complete blood count CBC with a peripheral smear, methylmalonic acid MMA levels, homocysteine levels. Your doctor will recommend treatment for low B12 levels. It may involve B12 injections, oral supplements, or treating an underlying health condition. B12 injections are recommended for people who can absorb B12 from food or supplements, such as those with gastric bypass surgery or autoimmune diseases. B12 injections and supplements are safe in high doses. If you like this video, please click like, share, subscribe, and turn on the notification bell so you don't miss a video from our channel.